Bioethics, presented by Guy Hill, Drew Montgomery, and Erica McAndrew. We will be discussing bioethics, which focuses on ethical decision making in healthcare, patient rights, and how providers ensure safe, respectful, and fair treatment. Bioethics is the study of moral principles in healthcare. It helps guide decisions about patient care, ensuring actions are ethical and focused on doing what is right for the patient. Bioethics is crucial for navigating complex moral issues in healthcare, biotechnology, and life sciences, ensuring that scientific advancements do not violate human rights or ethical principles. The history of bioethics began in the mid 20th century, emerging as a response to unethical human experimentation such as the Nazi experiments and rapid advancements in medical technology. The Nuremberg Code was created after World War II and established that voluntary consent is essential in research, helping protect individuals from unethical experimentation. The Belmont Report introduced three key principles: respect, beneficence, and justice, which continues to guide ethical research and healthcare practices today. The four main principles of bioethics are autonomy, beneficence, non maleficence, and justice. These guide healthcare providers in making ethical decisions based on client care. Autonomy means patients have the right to make their own decisions. Healthcare providers must respect these choices, even if it goes against their moral code or if they disagree. Beneficence focuses on doing what is best for the patient by promoting health, preventing harm, and acting in their overall best interest when it comes to providing health care for them. Non maleficence means do no harm in healthcare. It requires professionals to avoid causing unnecessary injury or suffering. This principle guides decisions by ensuring that the benefits of any treatment outweighs the risks to the patient. Justice ensures fairness in healthcare by providing equal treatment, avoiding discrimination, and distributing resources appropriately among all patients. Informed consent means patients receive clear information about treatments, understand the risks and the benefits, and voluntarily agree before care is provided. Valid consent includes disclosure, understanding, voluntarily agreement, and proper documentation, ensuring the patient is fully informed and not pressured. Some of the most common ethical issues in healthcare include end of life decisions where providers must respect patient wishes and dignity, organ transplants involving privacy, genetic testing, future risks, and allocations of limited resources. End of life ethics focuses on respecting a patient's wishes and maintaining dignity. Do not resuscitate orders indicate that no life saving measures should be taken. Advanced directives allow patients to outline their care, and palliative care prioritizes comfort, pain management. Confidentiality protects patient information. Healthcare providers must follow privacy laws and only share information when necessary for care to avoid violating HIPAA. Ethical dilemmas occur when there is no clear right answer. Providers must use critical thinking and ethical frameworks to make the best decision within the multidisciplinary team. Healthcare professionals play a critical role in ethical care by advocating for their patients and ensuring their voices are heard. They must follow ethical guidelines and use effective communication to build trust and understanding. Evidence based bioethics combines empirical data with clinical ethical analysis to guide decision making, ensuring practice is grounded in the best available scientific evidence rather than just intuition. Controversial medical advancements involve ethical dilemmas such as reverse engineering, homogeneity, stem cell research, IVF, and many other examples that we will discuss further.
One of the most promising treatment processes within bioethics scope involves stem cells. The issues surrounding stem cells include sourcing, application, as well as manner and degree of manipulation. To begin, let's discuss the defining characteristics of stem cells and how the various types differ from one another. The distinguishing qualities of stem cells are their ability to regenerate and differentiate. The regeneration capacity is ubiquitous to all stem cells. However, the ability to differentiate, while also universal, varies greatly and is therefore a key identifier between the types. The latter two, oligo and unipotent, are the most easily understood and least controversial given their limited differentiation capacities, unipotent being more restricted than oligopotent. These stem cells are committed to a particular tissue type. Unipotent cells, also known as adult progenitor cells, have essentially a one-to-one replacement ratio, meaning that they can only replace a single type of cell, even within a specific tissue type. The most familiar set of oligopotent stem cells are those dedicated to blood production. These hematopoietic stem cells were also the first to be used as treatment in the 1950s, in France to treat radiation exposure, and the USA to treat leukemia. Pluripotent cells can create tissues from all three germ layers, ecto, meso, and endoderm, while omnipotent stem cells can do the same along with giving rise to placenta, amnion, yolk sac, and allantois. This is where stem cells truly become controversial. It is easy to understand the accuracy and efficacy of stem cells which only create blood cells. However, how can we know that cells which are capable of differentiating into types as varied as neurons and muscle will do exactly as intended? Furthering the ethical dilemma, the best source of these cells involves the reproductive system. Using placental or umbilical tissue as a source is, for some, easy to justify, as they are the remnants of the life giving process itself. When fetuses or blastocysts are used as sources, the ethical issues get much more complicated, even if the treatment is an extension of their natural purpose to create the wide variety of cells necessary for life. The argument against these sources is the denial of full human potential. The argument for is the non viability of the embryo for various reasons, as well as the early stage at which they are sourced cleavage day 3 and blastocyst day 5 to 6. As of January 23rd, 2026, agency funded research within the US is no longer permitted to use human fetal tissue sourced from elective abortions. This leaves the sources of non viable embryos at fertility clinics and pluripotent induced stem cells. Another aspect of the ethical debate focuses on the question of control, efficacy, and accuracy of medical treatments. In other words, how do we know that the stem cells will do what we want them to do, both in their creation, regarding induced pluripotent cells, and in treatment? In order for a pharmaceutical to become FDA approved, dose amount, duration, therapeutic range, and other parameters must be consistently established via controlled studies. This is much easier to accomplish and trust regarding stable compounds than it is living, changing cells. Let's start with induced pluripotent cells. Given that the means by which they are reprogrammed back into the stem cell state overlaps heavily with the means by which the stem cells are instructed to become the desired end state cell. Chemicals, transcriptase, enzymes, microenvironments, meaning particular arrangements of particular proteins, aka bone matrix or liver tissue, are some of the various means by which stem cells are manipulated. Chemicals with names like OCT4, SOX2, and KLF4, proteins like integrins, cadherin, fibronectin, and enzymes such as Cas9 all possess the ability to direct a stem cell to a desired result. The most important shared aspect being that they are all the same mechanisms used by the body to direct differentiation, and the same principles, whether it be lock and key, inhibition, or stimulation, on which pharmaceutical allopathic treatment is based. Via these mechanisms, once a stem cell is sourced or induced, it offers a plethora of uses. In a lab, it can be allowed to run the same developmental course as before, providing a means by which to observe disease manifest, allowing identification of what went wrong and when. Organs can also be created, which would be an exact genetic match to the donor, greatly reducing the possibility of rejection. Or the cells can be injected to support the body's natural healing efforts.
The transition from medical ethics to biotechnology sees the introduction of a lot of medical innovation. However, there lingers questions around the types of technology being introduced and also whether human touch is being replaced by efficient policy and technique. Some core ideas of bioethics are derived from the Hippocratic tradition. The Hippocratic tradition, which dates back to the 4th century Oath of Hippocrates, set foundations for Western medicine. The first successful kidney transplant was done on December 23, 1954, in Boston by Dr. Joseph Murray, and the first human-to-human heart transplant was done on December 3, 1967, in South Africa by Dr. Christian Barnard. IVF has brought technology into childbirth. However, concerns have emerged about the exploitation of women through the procurement of eggs by payment, as well as broader debates on cloning and stem cell research. Affordable personal genome testing increased around 2003, so too did anxiety about genetic privacy. It wasn't until 2008 that federal legislation created protection from genetic discrimination by employers and insurance companies. Biotechnology incorporates both enhancement and therapy. Both physicians and scientists must work together to create this technology and to integrate it into patient care. The line between therapy and enhancement can easily be crossed. Enhancement seems geared toward a modification that brings a person closer to a perceived state of perfection. Therapy uses biotechnology in the presence of a disease to return the patient to the pre-illness state or healthier, whereas no disease needs to be present for enhancement. Some examples of biotechnology include human-animal hybrids, ozone therapy, cellular rejuvenation, and senescence. Hybrids in biotechnology include chimeras, hybrids, and cybrids. They are mainly used for research, drug testing, and growing tissues, but they raise ethical concerns, especially around creating and destroying embryos for medical purposes. Ozone therapy uses medical-grade ozone to increase the amount of oxygen in the body. This increased oxygen level induces cellular regeneration, which replaces and repairs damaged cells. There are several ways to administer ozone therapy. Some of the safer examples include applying it to the skin, introducing it through bodily openings, autohemotherapy, ingesting in liquid, or the intramuscular route. Ozone therapy potentially offers benefits like immune support, better circulation, reduced infections, and less inflammation, but research is limited. There's also research ongoing about its effectiveness for conditions like COPD, cancer, diabetes, arthritis, and chronic pain. Commonly, ozone therapy is done through hemoautotherapy, or passes. Each session ranges from 1 or 2 passes up to 10, with the cost of lower passes being around $300 all the way up to $900 per session. Scientists have found that the use of Yamanaka factors could counter the signs of aging and increase the lifespan in elderly mice, as well as accelerate muscle regeneration in younger mice. Rejuvenation therapies are administered through various methods. These methods include viral vectors, nanoparticles, liposomes, and CRISPR systems, each of these methods with their benefits and their challenges. Cellular rejuvenation therapies show great promise. However, bringing them into real-world use is difficult due to safety, effectiveness, ethical, and cost challenges. Major concerns include the risk for uncontrolled cell growth or cancer from altering fundamental cellular processes. Xenotherapeutics have shown promising results in animal studies in improving lung function, reducing inflammation, and even lowering mortality from infections. The same results show in early human trials. However, research is still ongoing. Xenotherapeutics used in older mice has shown improved recovery after heart attacks and regeneration of damaged heart cells. Aging reduces muscle regeneration as stem cells become senescent and less functional. In animal studies, xenotherapeutics have shown to improve muscle strength, endurance, and regeneration. However, human evidence is still being researched.